any successful quality implementation. Without it, I might as well forget about the whole idea of implementing quality. So, step one, get the leaders on board. Once they are committed, then I can move forward with the process of applying quality. Does that make sense? Yes, when I talk about organizational leadership roles, I am referring to the people at the top who guide and shape the overall direction of the company. These are the leaders who help steer the ship. They are the ones who influence decisions, set priorities, and inspire the organization to move towards its goals, like implementing quality. I might be wondering, why are leaders so important for change? Well, it's because change is hard to implement without a strong leadership. Leaders are the ones who set the vision and ensure everyone follows through. Without their commitment and support, it is easy for things to get off track. They provide guidance, giving the team a clear direction of where to go. I believe that leadership is the cornerstone of driving organizational excellence. I see my role as a leader, but not just a decision maker, but as someone who actively supports the organization's commitment to quality. I participate also in strategic planning, ensuring that quality initiatives are integral to our vision for success. I make it a priority to align all quality activities with our strategic goals, ensuring that every effort contributes meaningfully to the bigger picture. Finally, I recognize the power of engagement involving the stakeholders at every level to promote a culture of quality and safety that benefits everyone. Now let's explore the types of leadership styles, the different approaches leaders can adopt. The main styles include autocratic, democratic, laissez-faire, transformational, transactional, participative. I see decision making as a pivotal aspect of leadership. In an autocratic leadership, I take full responsibility for making decisions and then announce them to the team. I don't seek input or suggestions because in this approach, it is all about my judgment and the need for clarity and decisiveness. When it comes to rule enforcement, I strictly enforce the rules I set. My decisions are final, and I expect to everyone to follow them without exception. This structure creates order and ensures consistency, particularly in high pressure situations. I find that autocratic leadership is most effective in situations where immediate action is required, like during a crisis or an emergency. In those moments, I recognize that there is no time for lengthy discussions or team debates. Instead, I step in with a decisive approach, making rapid decisions to guide the team effectively. Imagine a natural disaster or an urgent safety issue. I know that in such scenarios, time is critical, and a clear, authoritative decision from me can save resources, protect people, or prevent further damage. While I understand that autocratic leadership may not suit everyday work situations, I value its ability to provide stability, order, and immediate solutions when emergency arise. For tasks requiring team collaboration or long-term engagement, though, I acknowledge that a different style may foster better results. To sum up, I view autocratic leadership as a tool best reserved for moments demanding quick, decisive action. It allows me to lead with authority, enforce rules efficiently, and address urgent challenges head on. However, I am mindful of its limitations in fostering team engagement or building trust during routine operations. Let me take you through the concept of transformational leadership, a style that focuses on inspiring, motivating, and uplifting team members' morale. I recognize that this approach is about creating an environment where individuals feel driven to achieve their goals, particularly during the initial stages of a project or task. Incentives and rewards play a key role in this process. There are three main aspects to transformational leadership: vision, team building, goal setting. So let's dive into each one. Vision. I understand that a transformational leader goes beyond managing day to day operations. They craft strategies that elevate their team, department, or organization to new levels of performance and success. A leader's vision for the future is grounded in defining clear goals, creating a supportive and collaborative atmosphere, encouraging teamwork and mutual trust, and helping the team achieve collective advancement, not just individual success. By focusing on these principles, I see how a transformational leader can guide their team to overcome challenges, stay motivated, and consistently perform at higher levels. When we say team building, the second key aspect, which emphasizes motivation and collaboration across all levels, I believe that a transformational leader excels in bringing together individuals from different departments and experience levels to work cohesively. Through fostering mutual respect and open communication, they create synergy that drives organizational success. Finally, transformational leaders excel at goal setting. I see their approach as highly strategic. They don't just provide vague instructions. Instead, they establish clear, actionable goals and provide incentives to push their team to exceed expectations. I think it's helpful to break these leadership styles into its core elements, known as the four I's. One is idealized influence, second is inspirational motivation, third is intellectual stimulation, and fourth is individualized consideration. When we say idealized influence, this inspire the trust and respect by leading with integrity. They set an example by maintaining high ethical standards and practicing what they preach. An inspirational motivation. I find this particularly powerful. Leaders inspire their teams with a compelling vision of the future. Through clear, passionate communication, they motivate individuals to push beyond their limits. Third is intellectual stimulation. A transformational leader challenges their team to think creatively and critically. I value their ability to encourage innovation while fostering an environment where constructive disagreement is welcome. Fourth is individualized consideration. The transformational leaders act as mentors, offering tailored support to their team members. I see this as a way to address individual needs while recognizing unique contributions that drive overall success. By understanding and implementing these principles, I believe any leader can inspire their team to achieve extraordinary results while fostering a positive and innovative work culture. I see a transactional leader as a style primarily focused on managing day to day operations and ensuring tasks are completed efficiently through clear structures and processes. The leader, when in such a role, is deeply involved in daily operations, closely monitoring progress and providing regular feedback. This hands on approach allows me to ensure that tasks are performed as expected and that the team has the necessary guidance to achieve specific goals. One of the key characteristics of transactional leadership is the emphasis on mentorship, training, and education, focusing on providing daily guidance to help the team navigate their responsibilities effectively. Motivation is in this style often comes through a system of rewards for success and penalties for failure. I believe this fosters accountability and helps maintain consistent performance. The primary goal of transactional leadership is to achieve specific, measurable outcomes. To do so, I make sure that my team clearly understands the instructions and follows them diligently. Teams are closely monitored and controlled to ensure alignment with expectations. In summary, transactional leadership as a method centered on managing the present, so it focuses on immediate objectives through structured guidance, training, and consistent engagement with team members. By applying this approach, I ensure stability, predictability, and efficiency in accomplishing the daily task. The participative leadership is one of the most effective and the best style of leadership. Why? Because it thrives on involving team members in the decision making process. It's all about consultation and collaboration where everyone's opinions are welcomed and valued. However, while everyone's input is important, the responsibility for the decision still lies with the leader. In the decision making process, as a participative leader, I would manage the decision making process. I will present decisions or ideas to staff, receive suggestions, then makes final decisions. This approach ensures that the staff feel heard and involved in shaping decisions. I will encourage open discussions, listens to the ideas, and welcome suggestions from everyone on the team. While I value everyone's input, I make the final decision to ensure the team stays aligned and focused. Focus on employee involvement. Participative leadership treats employee ideas with respect and consideration. I make sure to actively involve employees to foster a sense of ownership and responsibility. By taking their ideas seriously, I build trust and a stronger sense of value within the team. This involvement makes employees feel that their contributions truly matter. Consensus building. One of the most important aspects of participative leadership is consensus building. My goal is not necessarily to seek unanimous agreement from everyone, but to ensure all team members support the final decision. Even if some team members don't fully agree with the decision at first, by the end of the process, they understand and support it because they know it's the best choice for the team's benefit. It's important to differentiate consensus from unanimous agreement. Consensus means that while everyone may not agree initially, the team collectively supports the decision, while the unanimous agreement, on the other hand, means every team member agrees with the decision from the start and it aligns with their initial views. Why participative leadership is effective? Because it encourages team collaboration and builds trust. It enhances employee satisfaction and morale by giving them a voice in the process. It leads to well informed decisions as diverse perspectives are considered and promotes a sense of shared responsibility for outcomes. In conclusion, Participative leadership is about finding the right balance, gathering input from the team, building consensus, and ensuring the final decision reflects the collective benefit. This approach creates a collaborative and empowering environment where everyone feels that their contributions are valued. The participative leaders is considered the best leadership style because it fosters collaboration, trust, and mutual respect. Through a collaborative and inclusive approach, I can guide my team towards success while maintaining a positive and engaging atmosphere. I see the diplomatic or consultative leadership style as one characterized by persuasive decision making, much like the approach of a skilled salesperson, like a salesman. I focus on selling decision to the team, ensuring they understand the value and merit behind them. This style allows for some degree of freedom for the team, though it remains limited. Why? Because while I might provide a certain level of freedom, my ultimate goal is to align everyone with the decision I have already made. So I present the decision as a predefined outcome, but I take responsibility for actively explaining the reasoning and benefits behind it. In this approach, I bridge the gap between authoritative and participative leadership by ensuring the team not only understands but also supports the decision. I will make it a point to address concerns and emphasize the benefits, creating a sense of shared purpose even if the decision was not theirs initially. This style is particularly effective in specific scenarios such as redesigning quality improvement processes or managing transitions during mergers. For instance, if processes need restructuring, I use this style to guide the team through the changes. I ensure they see the need for the redesign, presenting the decision positively, explaining the benefits to both the team and the organization, and using persuasive communication to gain their agreement. Imagine that I am leading a quality improvement process redesign. So instead of I will impose changes outright, I would present the decision in a way that highlights its positive aspects. Explain. I will explain how the redesign benefits not only the organization but also the team itself. And I will also persuade the team to support the decision, ensuring alignment even if it wasn't their idea initially. To conclude, while participative leadership fosters collaboration and trust, I find diplomatic leadership invaluable in situations requiring persuasion, particularly when resistance to change is likely. Both styles have unique strengths that shine depending on the context. Next to discuss is the democratic leadership, fascinating as it mirrors a parliamentary system where decisions are based on the agreement of the majority. This leadership style thrives on collaboration and collective decision making, often achieved through voting or consensus building. As one of the key aspects I appreciate about this approach is how the leader presents challenges or problems to the team and encourages brainstorming for potential solutions. After gathering all the inputs, I observe that the leader often makes the final decision, weighing the majority's opinion or the most practical solution. The emphasis on inclusive decision making resonates because it ensures every voice is heard, fostering equality and shared responsibility. And we call it the agree of majority. Recognizing that this leadership style is the most effective when working with self-directed teams. These teams, with their clear understanding of roles, responsibilities, and goals, excel in managing themselves and contributing meaningfully to discussions. Therefore, democratic leadership as a model that promotes collaboration and inclusivity, making it ideal for teams that are both self reliant and capable of driving decisions forward collectively. Another leadership style is the laissez faire leadership, as defined by minimal involvement from the leader. In this style, I, for example, as the leader, step back and I will allow team members to make decisions and work independently. This leadership approach is built on trust and autonomy. The three aspects of these styles are with minimal interference, productivity concern, and self motivation. With minimal interference, I would allow employees to make decisions independently, meaning I remain passive and avoid intervening in their tasks or decision making processes. Team members enjoy complete freedom to manage their responsibilities, and I only provide guidance when they seek it. By stepping back, I encourage creativity and personal ownership in their approach to work. This style is with self motivation. This leadership style thrives when the team is composed of highly self motivated individuals. I believe it works best with employees who are skilled, confident, and capable of managing their own responsibilities. These individuals excel under autonomy and can deliver outstanding results without constant oversight. Lastly, with productivity concerns. However, I acknowledge that this approach has its challenges. One significant drawback is the potential for reduced productivity. Without clear direction or structure, some team members may lose focus or motivation. Understanding that this can hinder group performance, particularly in teams where members lack self drive or need consistent guidance. This style working most effectively in teams made up of skilled, knowledgeable, and independent individuals. So, when team members are confident in their ability to complete tasks autonomously, the laissez faire approach can foster innovation and efficiency. This leadership style relies on the independence and self motivation of team members. While it can lead to great results in the right environment, recognizing the importance of monitoring its potential pitfalls, such as reduced productivity when the team lacks motivation or clear objectives. So here's a quick recap of the three leadership styles. Understanding their key differences help you confidently distinguish between transactional, transformational, and participative leadership during revisions or when answering questions, as these styles are often confused. So when we say transactional leadership, the primary focus is managing day-to-day operations and tasks. The leader focuses on organizing daily activities, frequently arranges and attends meetings to ensure operations run smoothly. So let us have the clue word. Okay, if the question talks about managing daily tasks and regularly arranging meetings, the answer is transactional
Transactional leadership.
leadership. Yes. The transformational leadership, the transformational leadership's primary primary focus is goes beyond managing day-to-day operations to emphasize empowerment, encouragement, motivation, and inspiration to uplift teams' morale. The leader works to inspire and motivate the team and attends a series of meetings to discuss progress, provide guidance, and engage deeply with the team. If the question mentions empowerment in a series of meetings, the answer is transformational
Transformational
leadership.
leadership.
Okay. While the participative leadership primarily focuses on empowerment and encouragement, but with a more collaborative approach because the leader listens to the team and encourages participation in decision making and attends few meetings, relying on team inputs while giving members autonomy to manage their tasks. Keyword: if the question talks about empowerment but mentions attending few meetings, the answer is participative
Participate leadership.
leadership. Okay, clear?
Yes.
Let's explore the framework of directive and behavior and supportive behavior. Leadership, as we understand it, involves adapting behaviors to meet the specific needs of the team. This framework outlines the four distinct styles to meet the specific needs of the team. This framework outlines the distinct styles that balance directive, which is the task focused, and supportive, which is a people focused approaches. In delegating, which is low supportive and low directive behavior. In this style, the leader steps back, delegating tasks entirely to the team. The team works independently, requiring minimal guidance or motivation. It works best for experienced, self motivated, and capable teams who know what to do and how to do it. I can give you an example. A senior software development team working on a routine feature update doesn't need constant check ins. The leader assigns the task and trusts the team to deliver. Another style is supporting, high supportive and low directive behavior. This style emphasizes motivation and encouragement while allowing the team to make decisions and manage tasks autonomously. It works best for teams that are competent but may lack confidence or need emotional support, like a marketing team launching a campaign independently, with the leader offering encouragement and feedback when needed only, but not dictating the process. The third style is coaching, high directive and high supportive behavior. This is a balanced approach, combining clear guidance with emotional support. It is the only style that is both high in directive and supportive behavior. Leaders using this style provide instructions while also encouraging and empowering the team to build confidence and skills. Teams learning new tasks or facing unfamiliar challenges benefit most from this style. For instance, when I am training a new sales team, I might provide them with a detailed script for client interactions while motivating them with regular feedback and encouragement. And the last style is directing. This style is about giving specific instructions and closely monitoring tasks with a focus entirely on task completion rather than emotional or motivational support. It is ideal for new employees, crisis situations, or tasks requiring strict adherence to rules and procedures. An example could be a factory manager instructing workers on how to operate a new machine safely. Here, I would ensure no room for error, but offer minimal encouragement as the priority is strict compliance. To recap, delegating style is low, supporting, high supportive, and low directive behavior, while coaching, high directive and high supportive behavior, and lastly, directing, high directive and low supportive behavior. The effectiveness of each style. depends on the maturity and skill level of the team, as well as the task at hand. A good leader knows when to shift between the styles based on the situation. This framework particularly helpful in differentiating leadership approaches to meet team needs effectively. I believe a successful leaders share common traits that inspire trust, drive results, and foster growth. The vision or future ambition that I aim to achieve must include the following key elements for effective leadership. A successful leader has a clear vision for the future and knows how to communicate it effectively to guide the organization toward shared goals. Another essential element is integrity. Having honesty and practicing ethical behavior are fundamental for leadership success. I recognize that leaders must demonstrate integrity in their decisions and actions, setting the foundation for trust and respect among employees. Communication is another cornerstone of leadership. I understand that effective leaders communicate clearly, listen actively, and inspire their teams through their words and actions. To lead effectively, I must communicate transparently, ensuring data and information are presented clearly so all team members are informed and aligned. Transparency builds trust and motivates employees toward shared objectives. Modeling behavior is critical as well. I strive to embody the values and behaviors I expect from my team. When addressing expectations or tasks, I will demonstrate them first, setting as an example for others to follow. By exemplifying commitment to rules and regulations, I will reinforce accountability and foster a culture of reliability. Accountability is a trait that we will value deeply. I, for example, as a leader, must take full responsibility for their actions and decisions, holding myself to the same standards as my employees, accepting the consequences of mistakes and using them as opportunities to improve. This approach helps foster trust and reliability within the organization. Lastly, consistency is vital. I will ensure that my actions consistently align with the stated values and goals of the organization. Any improvements or initiatives I undertake must be suitable and support long term objectives. By combining all these traits vision, integrity, communication, modeling behavior, consistency, accountability I will aim not only to earn respect, but also to drive a culture of excellence, trust, and continuous improvement. Leadership and management are often used interchangeably, but they have distinct roles and functions. While both are essential for organizational success, they focus on different aspects of guiding people and processes. Leadership produces change and movement. It is about establishing vision, clarifying the big picture, and setting strategies while inspiring and motivating others, focusing on setting direction, creating a vision for the future, and inspiring others to achieve it. Leadership aligns people through communication of goals, seeking commitment, and building teams, coalitions, and alliances. Great leaders connect people to a common goal by communicating a clear and compelling vision, ensuring everyone understands the direction and their role in achieving it. I see leadership as focusing on people and inspiration. A great leader energizes and empowers subordinates and colleagues, addressing unmet needs. Leadership goes beyond achieving goals. It is about energizing teams, empowering individuals, and helping people fulfill their unmet needs, whether those involve career, aspirations, recognition, or personal growth. While management, on the other hand, produces order and consistency. It focuses on planning, budgeting to establish agendas, set timetables, and allocate resources. Organizing and staffing are also essential aspects of management. Managers provide structure, make job placements, and establish rules and procedures. Lastly, management involves controlling and problem solving by developing incentives, generating creative solutions, and taking corrective actions when necessary. A manager reorganizes tasks, sets clear timelines, and allocates resources to ensure deadlines are met. He ensures tasks are completed efficiently, processes run smoothly, and goals are achieved. Leadership and management complement each other, creating a balance between inspiration and operational efficiency. We have understood the importance of leaders in driving improvement. Now, let us explore how we can initiate and work on improvement. The first step is to shift our mindset towards system thinking. This approach emphasizes looking beyond surface level issues to identify and address the root causes and system problems. The next topic is about system thinking in healthcare. We will first we will first what is this? Identify these words. The meaning of events here are the occurrences within the healthcare system. For the patterns, these are trends observed over time in healthcare delivery. System structure means policies, the laws, and resources shaping the healthcare, while the mental models are the beliefs and assumptions about the healthcare system. What is system thinking? System thinking can be visualized as an iceberg. Okay, it is an iceberg. Above the water is what is seen, in which it is the visible tip of the iceberg, representing the problems or symptoms we immediately notice, like a missed project deadline or a sudden drop in income of the hospital and employee burnout. Below the water represents what is unseen, the larger hidden portion beneath the surface symbolizes the root causes and systemic issues that lead to these events. The goal of system thinking is to focus on what is unseen, uncovering the underlying issues that contribute to the problem. These hidden issues are referred to as latent errors, like poor communication channels, failed processes or workflows, and misaligned goals across teams. These latent errors are the hidden flaws or failures or systemic weaknesses within a process that contribute to an event or failure. Addressing these errors is crucial to create sustainable improvements and preventing similar events in the future. How system thinking helps in improvement. If an event occurs, I do not focus solely on the immediate issue. Instead, I investigate the root causes. What is hidden beneath the surface? Next is to identify the systemic problems that allowed the error or failure to happen. Then develop solutions that address both the visible symptoms and the hidden systemic issues. By adopting systemic thinking, I ensure that our improvements are not just reactive, but also proactive, utilizing FEMIA and sustainable. This mindset enables me to see the bigger picture and address the foundation of the issues, reducing the likelihood of recurring problems. To thoroughly address errors and improve processes, I need to investigate the root causes by applying system thinking. How will I use the approach of system thinking? By following these steps. First is observing and analyzing patterns of behavior over time. Patterns, trends observed over time in the healthcare delivery. In this step is training myself to observe recurring issues like if a medication error occurs, investigate how often similar errors have happened over a defined period, and understand patterns and trends in errors to identify systemic weaknesses. The second step is investigating the structure of the system, leads to learning on how to build smarter, more efficient, and sustainable systems. The more I understand the why behind the what, the more effective my solutions will be. Examining the policies, procedures, laws, and regulations governing processes we have in our organization, such as medication administration. Are there protocols ensuring proper verification? What about medication dispensing? Are there clear guidelines for pharmacists to follow? I must identify gaps in these structures that may have contributed to the error. The next step is challenging assumptions and beliefs. By reviewing assumptions about healthcare system like the policies, do I assume that policies are being followed? Are there unspoken beliefs that certain tasks like double checking are not necessary? Through building mental models to visualize the flow of the system and where breakdowns might occur, and I will locate the leverage points by identifying small changes that can produce significant positive results. Fourth step is tracing the sequence of events. This approach goes beyond focusing on the individual mistake to uncover the sequence of events and root causes behind the error. A scenario like a nurse administers the wrong medication to a patient. Key questions to ask are: what happened? The nurse dispensed the medication from the pharmacy but did not cross check the prescription. Why was the medication incorrect? The pharmacy dispensed the wrong medication because the drugs looked alike and were stored close to each other. Another question is: why was there no safeguard against this error? Obviously, there is no system for segregation of look-alike medications. No double-checking process was in place for the pharmacist or nurse. The fifth step is about identifying latent errors or the unseen causes. Using system thinking, the latent errors in this scenario might include the lack of segregation systems for look-alike medications, the absence of a double check protocol in the pharmacy and during medication administration, or even inadequate training for nurses and pharmacists to recognize high risk medications. And lastly is the system thinking in action. Rather than focusing only on the nurse's or pharmacist's immediate mistake, which are the visible errors, system thinking digs deeper to find the unseen causes like inadequate policies for medication safety, poor storage practices in the pharmacy, and lack of communication and double checking processes. System thinking emphasizes addressing the latent errors and systematic weaknesses that allow errors to occur. We focus on the root causes. We can develop effective solutions such as implementing clear segregation systems for medications, establishing mandatory double check protocols for dispensing and administering medications, and enhancing training to improve error recognition and prevention. This approach not only resolves immediate issues, but also strengthens the overall system to prevent similar errors in the future. The second application of system thinking is root cause analysis, or the RCA. A detailed discussion on this topic will be covered during our patient safety lecture, but I will discuss the process. So I start by doing one, problem identification. By clearly defining the issue in the healthcare delivery, this is to clearly identify the specific problem that occurred in the healthcare delivery. It's about pinpointing exactly what went wrong and understanding the nature of the issue. Then I start doing data collection by gathering relevant information about the problem. I gather all the relevant data to understand what happened, where it happened, and at which step in the process the error occurred. After that, I draw another set of steps for the cause identification, which is to determine the root cause of the issue. It is whether the actual process, which answers the question how it happened, or the ideal process. It answers the question how it should have happened. By comparing these two, I can identify where the error occurred and understand the exact step that caused the issue. Once I identify it, I work on developing solutions and implementing these solutions to prevent recurrence. The goal is to prevent this from happening again in the future. Clear? Let's talk about ambulatory care quality management or settings and compare them to inpatient care. I start by identifying what ambulatory care is. It refers to primary care centers or the outpatient care where there is no admission of patients. On the other hand, hospitals involve inpatient care where patients are admitted for treatment. There are special problems for quality management in ambulatory care. These special problems or challenges we face in the ambulatory care setting are scattered care, where source of care is dispersed with no common medical record that is shared across all ambulatory care settings. This lack of a unified medical record creates inconsistencies and makes it harder to manage patient care effectively because this causes the fragmentation of care due to the dispersed nature of the system that makes it difficult to implement a standard quality management system across all centers. This distinction between ambulatory care and inpatient care highlights the challenges specific to each setting, particularly the absence of a centralized system in ambulatory care. Imagine this common scenario of our patient's medical care journey. Today, a patient visits an orthopedic specialist, one medical complex. Next week, they go to a different clinic, let's say endocrinology, to get medication for diabetes or hypertension. Later, they visit yet another location for internal medicine or dental care. So, what will be the result? Their medical history is scattered across different facilities with no integration. This lack of connection between care providers makes it harder to design and manage a seamless, continuous care plan for the patient. In the record management in outpatient setting, the medical record systems play a critical role in ensuring seamless patient care. However, In many outpatient settings, these systems are often underdeveloped, which they can compromise patient care, leading to challenges like long waits and experience or repeated questions during a visit because records were not easily accessible. Outpatient clinics is lack of standardization because often use outdated or paper-based systems, making it hard to share and retrieve data efficiently. Additionally, there's another issue. The patient is in control. Patients have more control over diet and medication adherence. They are responsible for diet control, which means following dietary recommendations provided by their physician. Medication adherence by taking prescribed medications on time and in the correct dosage, and following instructions by sticking to lifestyle changes, follow up appointments, and other advice. Another significant issue in ambulatory care is wrong access to specialties. Most patients face challenges in accessing the appropriate specialty care. For instance, if they feel chest pain, they might directly visit a pulmonologist. If they have back pain, they go to an orthopedist. However, they rarely consult a family physician who could properly guide them to the appropriate specialty. These problems highlight the challenges in quality management within the ambulatory setting. These systemic issues impact the effectiveness of outpatient quality management. Let's proceed to the next slide. It is about the managed care organization can be briefly defined as an insurance companies. In the United States, insurance companies operate through managed care organizations, taking on the dual responsibility of delivering and financing health care. They coordinate with providers to ensure that care is delivered efficiently and at a controlled cost, while also managing the payments for these services. In delivering healthcare services, the insurance companies or the payer establish networks of healthcare providers such as hospitals, clinics, physicians to ensure patients receive care. They also implement systems to oversee the quality and efficiency of care delivery. For example, of a preventive care. A patient with insurance is due for an annual checkup. The insurance company provides the access, provides encouragement, and provides monitoring. The access ensuring the patient has a list of in-network providers to choose from. When we say provides encouragement, this is to cover the cost of preventive care like vaccinations and screenings to reduce the risk of expensive treatments later. And monitoring is by tracking if the patient follows up on recommended screenings like mammograms or colonoscopies. In the long run, there is a provision of preventive care benefits for both patients and insurance companies. Meanwhile, financing healthcare services, the insurance companies are responsible for managing the cost of healthcare by negotiating rates with providers and ensuring payments are processed accurately. The best example is the hospital stay of our patient. He needs surgery and is admitted to a hospital in the insurance company's network. The insurance company then handles negotiation. Then comes the approval, then the coverage. When we say negotiation, this means it has pre-agreed rates with the hospital, ensuring that costs are predictable and lower than out-of-network charges. Then comes the approval, reviews the necessity of the surgery before approving the payment. Then comes the coverage, pays the majority of the bill while the patient pays their share, and you call it the co-pay or deductible. The MCO or the managed care organization acts as a link Acts as a link among the provider, patient, and the payer. Provider, these are the healthcare providers, such as hospitals or ambulatory care settings. The patient is the insured individual, such as engineer, nurses, doctors, employees, or worker employed by the company. And the payer, entities like the construction company, hospital that contract with the MCO for insurance policies. Both the patient and the healthcare provider must adhere to the rules and regulations set by the managed care organization. There are agreements in place to ensure smooth interaction between all parties involved, where the patient agrees to the payments for the services while the provider agrees to accept the fees the MCO offers for services. We have examples of managed care organizations include well-known companies like Bupa, Al Rajhi Takaful, MedGulf, AXA in other regions. Health maintenance organizations, or the HMOs, and organizations that share financial insurance and risk of service. HMO definition is an organization that provides health insurance coverage for a fee while sharing the financial risk and responsibility of care with contracted providers. Like patients pay a monthly premium for access to care. The organization focuses on cost control through prevention and efficiency. Now, how does an HMO work? The structure where group of medical providers under contract to the HMO, such as hospitals, doctors, labs, these contracts ensure providers agree to deliver care at negotiated rates, keeping costs predictable. Another defining feature of HMO, or the health maintenance organizations, is the coverage. And patients receive care exclusively from in-network providers unless it is an emergency. An example of structure in action: when I need surgery with an HMO, I visit their primary care physician, or the PCP, first, who acts as a caretaker, then get referred to a specialist within the HMO network if needed. This approach helps control costs by preventing unnecessary tests and procedures and negotiating discounted rates with providers. Benefits of HMO is to lower costs, which typically have lower premiums and out-of-pocket expenses. Secondly, emphasis on preventive care like covering wellness visits, vaccinations, and screenings at no additional cost. And coordinated care, wherein the primary care physician, or the PCP, ensures all treatments are aligned and necessary. Meanwhile, challenges of HMO have limited flexibility that patients cannot see out of network providers unless it is an emergency. Referral system as well, because PCP referrals for specialists can feel restrictive or time consuming. And it has provider frustrations, where contracted providers may feel pressured to limit services to control the costs. Healthcare reimbursement systems determine how payments are made for medical services. The two major types are retrospective payment system and the prospective payment system. When we say retrospective payment system, retro means after. In a respective system, payments are made after the service is provided, which is based on the actual cost of care. Costs are determined by the actual service provided, which may vary from patient to patient, which includes models like fee for service, or FFS. This payment is based on each service provided. And the other is discounted FFS. Providers agree to offer services at reduced rates for insured patients. For example, a patient visits a clinic, undergoes a checkup, and then receives a bill. The total payment depends on the exact tests, consultations, and treatments provided during the visit. The second type is the prospective payment. Pro means before. In a prospective system, payments are made before services are provided based on a predetermined fixed amount. I will give an example like an employer pays a fixed amount per employee per year for health insurance. The insurance covers routine checkups and other medical care, whether or not the employee actually uses the services. When healthcare reimbursement systems are designed thoughtfully, they offer several advantages, and this encourages the organization for balanced use of resources, meaning healthcare organizations are incentivized to avoid overuse or underuse of resources. By promoting efficiency, these systems ensure such resources like beds, medical staff, and equipment are used wisely, as well as unnecessary tests, treatments, or extended hospital stays are minimized. In a prospective payment system, hospitals receive a fixed amount for a procedure. This encourages them to plan and manage resources efficiently without sacrificing quality. Another advantage is efficient hospital stays with discharge as soon as medically possible. These systems push healthcare providers to optimize care and discharge patients as soon as it is medically safe to do so. This reduces unnecessary days in the hospital, which lowers costs for the system and patients, reduces the risk of hospital acquired infections, and opens up space for other patients in need. In a retrospective payment system, a hospital ensures timely discharges by coordinating follow up care with outpatient services to maintain quality without further delays. In managed care system, capitation and co-payment are two important payment methods that determine how healthcare costs are shared between providers, insurers, and patients. Capitation is a payment method where healthcare providers receive a fixed amount per patient per month or year, regardless of how many services the patient uses. This payment is predetermined and not based on the volume of care provided. It works when an insurance company or managed care organization contracts with providers from hospitals, clinics, or physicians. They are paid a fixed amount per enrolled patient under their care. The payment covers a set range of services agreed upon in the contract, like a primary care physician contracts with an HMO, health maintenance organization. The HMO agrees to pay the physician $30 per member per month for 500 enrolled members. Therefore, the physician receives $15,000 per month, regardless of how many times each patient visits or the complexity of care provided. The service coverage is that The physician is responsible for all basic healthcare needs of these 500 members, such as consultations, preventive care, and minor treatments. Now the question is, would the physician benefits financially? Of course, yes. If fewer patients use the services, the physician benefits financially. But if many patients require care, the physician must manage cost efficiently to avoid overspending. About the advantages of capitation, we can predict the cost expenses and helps in budgeting and financial planning, focusing on preventive care by reducing the need for costly treatments and efficiently use resources through optimization of care delivery and avoiding unnecessary tests or procedures. Also come with significant challenges. Under capitation, providers are paid a fixed amount per patient, regardless of how many services the patient needs. This means if patients require extensive or costly care, the provider must cover the expenses resulting to risk financial losses. If the cost of care exceeds the fixed payment, for example, a provider receives $30 per patient per month, and if patient needs frequent visits, costly tests, or complex treatments, the provider's expenses could quickly compensate the capitation payment. Another challenge is the risk of undertreatment because providers must manage care within the fixed payment. They might limit services or avoid expensive procedures to stay within budget, and they will only prioritize cost saving over patient care, leading to undertreatment or delayed interventions. While the co-payment or co-pay method, this involves patients paying a fixed out-of-pocket amount for healthcare services at the time of their visit, while the insurance covers the rest. I see this approach as a balance between affordability and cost control. For example, a patient might pay $20 for a doctor's visit, while the insurance company handles the remaining costs as specified in the policy. The benefits of copayment are cost sharing, affordability, and careful use of resources. The challenges are financial burden. We recognize that frequent co-payments can quickly become a stress, especially for those with chronic conditions or families with multiple dependents. Patients with ongoing needs like diabetes or hypertension often face significant cumulative costs, while the other challenge is barriers to access. Co-payments can prevent some patients from seeking timely care, leading to delays and worsening health conditions like a patient avoiding a $50 co-payment for mild chest pain may later require a costly ER visit for a heart attack, escalating both health and financial consequences. Many managed care plans combine capitation and co-payment to create a balance between cost control and shared responsibility. This integration allows insurers, providers, and patients to contribute to the sustainability of the system. Like if a patient visits their primary care physician for a routine checkup, the provider is paid via capitation, which is $30 per month. So there is no co-payment required for this visit. And also, if the primary care physician refers the patient to a specialist for further evaluation, the patient pays only $20 as co-payment to see the specialist. In healthcare, complications and comorbidities are critical terms that influence patient care and outcomes, though they differ in definition and impact. When we say complication, we define it as a condition that arises after admissions, aggravating the original disease or its treatment. These events increase the complexity of care, requiring additional interventions and prolonging hospital stays. For example, post-surgical complications like infections or blood clots that delays recovery. Another example, medication-induced issues such as GI bleeding or allergic reactions that disrupt treatment, and disease-related complications like heart failure in pneumonia or diabetic ketoacidosis demand critical care. Complications lead to extended recovery times and higher costs due to added treatments and care needs, while comorbidities, in contrast, are existing conditions present at admission that coexist with the primary disease, complicating its management. These secondary conditions like hypertension with diabetes or asthma with pneumonia require adjustments to treatment plans, careful monitoring, and integration of therapies. For instance, chronic diseases can heighten risk, such as cardiovascular complications in diabetics with hypertension. Mental health issues like depression in cancer patients impact adherence to treatment. Respiratory conditions like COPD in smokers and complicate recovery from infections or surgeries. Comorbidities often lead to prolonged length of hospital stays or the LOS, complex care plans, and poorer outcomes due to the interplay of multiple conditions. Understanding the distinction between these terms and addressing them through early detection, prevention, and integrated care is essential for improving healthcare delivery and patient outcomes. This topic is one of the most critical sections we have in quality, and here's why. I will discuss on the cost of quality in healthcare. If we aim to implement quality initiatives but lack the support of our senior leadership, this is where we start. Convincing our senior leaders and stakeholders of our organization about the importance of quality is important. Why is this so important? Because the cost of quality in healthcare demonstrates the financial and operational impact or failing of implementing of quality measures. It is categorized into three key components: price of non-conformance, which is cost of poor quality. Second is price of conformance, cost of quality, and financial reporting. Price of non-conformance, or the cost of poor quality, is the cost incurred due to not implementing quality processes from the beginning. These costs are related to errors that need to be corrected later and issues that arise from falling or from failing to properly implement. If we don't establish quality control measures upfront, errors will occur during the process. This may result in a wrong site surgery, performing surgery on the incorrect site, which could have been prevented with proper quality implementation. Instead of ensuring the correct procedure beforehand, no checks were performed, leading to a significant and avoidable mistake. This emphasizes the importance of embedding quality systems early to avoid high costs and severe consequences due to errors in processes or outcomes. If there's no compliance with proper hygiene protocols, a surgical site infection could occur. This leads to problems and lawsuits for compensation. A single lawsuit could wipe out all the profits your organization has accumulated since its inception. Beyond financial losses, think about your reputation. What happens to the name of the hospital? If the reputation is damaged, then it's over. The hospital's name loses its value. Imagine someone asking about the value of the hospital's name. Its reputation is priceless. If the hospital's reputation is tarnished, you have not only lost financially, but also lost the trust of all potential customers. So why not do things right from the start to avoid all the negative impacts that could result from failing to implement quality practices from the beginning? This is where the price of conformance, the cost of executing quality measures and doing things right initially comes in. It is the cost of quality that you invest to ensure things are done correctly from the beginning. For example, some might argue that there's no need to incur this cost upfront, but in reality, it is necessary. It is critical because failing to invest in quality early on can lead to much greater losses, both financially and reputationally, down the side. The cost of quality cannot be compared to the cost of quality failures, such as dealing with a compensation lawsuit or the damage to your reputation, name, and brand. That is why the price of conformance or the cost of quality refers to the investment made to implement quality processes and establish standards from the very beginning. It works if the initial cost of conformance includes setting up a structured system, meeting certification requirements, and conducting thorough staff training. In overtime, this cost shifts into ongoing maintenance, like regular audits and evaluations, and routine training for new members. By doing so, the organization minimizes risk and prevent errors before they occur. This is a proactive approach, reduces the likelihood of costly mistakes, lawsuits, and damage to the hospital's reputation. Once the quality system is in place, the focus shifts to maintenance and monitoring, which are more affordable and sustainable. In the financial reporting, which means identifying and reporting quality costs to support organizational commitment, is required to highlight areas where quality issues are driving up expenses, justify investments in quality improvement initiatives, and demonstrate organizational commitment to patient safety and care excellence. Like a hospital's financial report shows high costs associated with hospital-acquired infections, leadership uses this data to allocate resources for enhanced infection control measures. In the long run, implementing quality systems from the beginning transforms healthcare delivery, ensures compliance, and protects the organization from unnecessary losses and risk. The Quality Council roles is crucial in understanding the role of quality within an organization. So, what is the Quality Council? The Quality Council is also referred to as the Steering Committee. A steering committee composed of departmental heads and section leaders. This committee plays a pivotal role in approving improvement projects, assessing and evaluating improvement initiatives, and determining the priority of improvement projects based on the organization's vision and mission. The core responsibilities of Quality Council are direction oversight, prioritization, team selection, and evaluation. When we say direction, oversight provides organizational direction for quality improvement efforts, ensuring the alignment with strategic goals. Prioritization, identify and prioritize improvement opportunities, which do determine the priority of performance improvement opportunities and selecting which initiatives to address first based on their potential impact. When we say team selection, chooses the quality improvement team responsible for implementing specific projects. Evaluation, review the outcomes and assess effectiveness of quality initiatives by evaluating the performance of improvement teams during and after the projects. Decides on disbanding or restructuring teams once tasks are completed. The Quality Council ensures that quality improvement efforts are structured, effective, and aligned with the organization's overarching goals, making it a cornerstone of organizational success. To successfully implement quality initiatives, it is essential to prioritize them based on their potential impact, resource allocation, and alignment with the organizational goals. Prioritization is based on the several key factors that includes impact assessment, which means evaluating the potential impact on patients, especially issues that pose high harm or represent critical problems for patients. Second, resource allocation. Consider available resources and feasibility. Problems that consume significant resources over time and lead to ongoing costs for the organization are given priority. Alignment with organizational goals, ensuring initiatives align with the organizational goals and mission. All improvement projects that are highly aligned with the organization's strategic objectives and quality goals are prioritized. When it comes to improving quality in healthcare, it is critical to focus on high priority issues that have the greatest impact on patient safety, organizational efficiency, and financial sustainability. To expound more, high risk problems high-risk problems addressing to patient safety. These are issues that pose significant risk to patient safety, potentially leading to serious harm or adverse outcomes, like medication errors that lead to harmful reactions, incorrect surgical procedures or site marking, delays in critical care for emergency like strokes or heart attacks. High volume problems. These are problems that occur frequently, affecting a large number of patients or processes. Addressing high volume issues can significantly improve efficiency and outcomes, like long wait times in emergency departments, delays in lab testing processing for routine diagnostics, and frequent errors in patient admissions or billing systems. Next, problem prone. Persistent problems are those that remain unresolved over time, continuously affecting patient outcomes or organizational performance. For example, recurring hospital acquired infections, repeated complaints about staff communication, and chronic underuse of preventive screenings like mammograms or colonoscopies. For the high cost, these are problems that result in significant financial costs due to their recurrence or complexity. Addressing them can reduce waste and improve financial sustainability, like readmissions for preventive conditions like pneumonia or heart failure. Second is unnecessary diagnostic tests or procedures, and extended hospital stays due to avoidable complications. Projects are prioritized based on the risk, frequency, impact on patients, and the organization, alignment with organizational goals, and the cost implications of leaving them unresolved. By addressing the high risk, high volume, prone problem, and high cost, first, the organization ensures the efficient use of resources while improving patient outcomes and achieving its strategic objectives. Now that we understand the roles of the Quality Council, we recognize that their role is essential and critical in implementing quality. The first step we as a Quality Council we will take to engage with you, collaborate with you, and work together to achieve quality is to achieve the mission, vision, and values. These components provide a clear direction and align efforts across the organization. I will discuss about its significance. Let's start with the vision 1. It is the aspirational view of the organization's future. The vision is an organization's long-term aspirational goal. It is a clear picture of what it wants to achieve in the future. It answers the question, what we want to become and achieve. Where do we want to go? It inspires action by giving a sense of purpose. It provides a North Star for decision making and strategic planning. It also focuses on the big picture rather than day to day operations. An example of a healthcare organization vision might be a leading investment services institution in Saudi Arabia. Mission, the core purpose and focus of the organization. The mission explains why the organization exists and what it strives to accomplish in the present. It answers the question, why do we exist and what do we aim to achieve? Mission defines the organization's core purpose and primary activities. It focuses on the here and now rather than the future, and it helps employees understand their role in achieving the organization's goal. For example, the treat our clients as partners and provide high quality, distinctive investment products and services. Values, the guiding principles that shape organizational culture. The values reflect the beliefs and principles that shape the organization's culture and behavior. It guides the decision-making and interactions with employees, customers, and stakeholders. It serves as a moral compass for the organization and define how the organization operates daily. They answer the question, the values we believe in and how we will act. The values of a healthcare organization might include, example, integrity, professionalism, loyalty, commitment, and local knowledge. By establishing a clear vision, mission values, the Quality Council creates a foundation for collaboration and ensures that everyone within the organization is aligned toward achieving common goals in quality improvement. These steps ensures that all efforts are unified and strategically driven. Strategic planning in healthcare is crucial for healthcare organizations to align their efforts, adapt to changes, and achieve long-term goals. It involves analyzing the current state, future state, and creating an action plan to bridge the gap. In the current state, we assess what the organization is currently doing. This step involves evaluating the organization's current operations, performance, and environment. Second is the future state. Determine what the organization should be doing. Here, the organization defines its long-term visions and sets specific measurable goals to move closer to that vision. Third is the action plan, developing the strategies for achieving desired outcomes. This action plan outlines the steps and resources required to move from the current state to the future step. How to formulate an action plan? First step is to define priorities, focusing on high impact goals. Second is allocate resources, assigning budgets, staff, and technology. Third is set timelines. You create milestones for tracking progress. And fourth is monitor and adjust by using performance metrics to ensure the plan stays on track. There are critical questions in strategic planning. Number one, what are we doing? This is to assess current processes and identify what is working and what is not. What should we be doing? This is to align activities with the organization's vision and mission. The third is what should we be doing next? It is prioritizing actions based on impact and feasibility. Fourth, how should we be doing it? By developing efficient and effective strategies to implement changes. And lastly, what should we not be doing? By eliminating activities that don't align with goals or add value. The first step in the strategic planning is to identify the strengths and weaknesses. Because when I identify, I conduct a SWOT analysis and determine the strengths and weaknesses. I set myself goals to address the weaknesses. For example, what does this SWOT analysis mean? It means S for strengths, W for weaknesses, O for opportunities, and T for threats. This means I identify the internal aspects. The strengths and weaknesses within the organization. For example, when I talk about strengths, I could say that we have a special expertise that is unique to us. Reputation, the cost, and all the advantages we have within the organization. These go under strengths, and these are internal factors. In the weaknesses within the organization, I will write them under here weaknesses, as they are also considered internal. Weaknesses such as limited services line or support business negotiations and internal problems within the organization will all be listed here under weaknesses. So I have identified the internal strengths and weaknesses. I will also write down the external factors in the organization. I will identify the opportunities and threats affecting the organization. I will identify the opportunities and threats affecting the organization. For example, new technologies, market challenges, new resources, and external issues impacting the organization will be listed here. Additionally, threats that endanger my organization's survival in the community, such as new competitors, shifts in the market, economic changes, or any challenges threatening our presence, will also be listed under threats. So opportunities and threats are external factors. We have established that the first step in setting up a strategic plan is to analyze and identify these aspects, just like when considering market participation, vision, and value, like how American companies strategize. The first thing leaders do is to set the mission. The top leader and governing body, the first thing that they must do is to set the mission, vision, and values. After that, we move into strategic planning. The first step in strategic planning is the SWOT analysis. The SWOT analysis is always the first step in strategic planning. Why? Because from the SWOT analysis, I can extract goals and objectives. How? For example, if I identify the weaknesses that there's management of staff problems, I will set a goal to increase staff work satisfaction and hire more staff. So all the problems I identify in weaknesses and strengths will guide me in setting goals. Now, from these goals, I will derive objectives. What's the difference between goals and objectives? Goals are long-term outcomes written as an overall statement. It is like a general sentence. For instance, I might say, I will increase staff work satisfaction. But how? I didn't explain how, right? So goals never answer how. In contrast, objective always answer the how. For example, after stating the goal of increased staff work satisfaction, I would specify how to achieve it. I might say recognize and reward efforts, foster communication, open communication, or support professional growth by ongoing training. Here, I'm starting to answer the how by determining the necessary initiatives, identifying the responsible person who will address these strategies, specifying the service details, the timeline, and the required budget. So objectives are more quantitative, more specific to time and responsibility, and they answer the how. Of course, both goals and objectives need to be SMART, meaning specific, measurable, attainable, relevant, and time-bound. A SMART goal or objective ensures clarity and feasibility in planning. It should be related to the topic being discussed, essential, and yes, inspiring, but also specific. For example, it needs to be time-bound, meaning it has a set start and end time. So goals must be inspiring and specific at the same time. Let's go back to strategic planning. When we want to create a strategic planning or plan, we start with a SWOT analysis. In the SWOT analysis, I identify the internal strengths and weaknesses as well as the opportunities and threats. After that, I move on to setting goals. From the weaknesses and strengths, I derive the goals. These goals are general statements such as, I want to decrease patient waiting time in triage from 80% to 90%. This is a goal because it doesn't answer the how. It is a broad statement. When I move to the objectives, I define how I will achieve this goal. For example, I might say, I will introduce a new service or I will hire new staff. In the objectives, I specify the initiatives required. From these objectives, I extract the strategic initiatives or the department-specific actions that need to be implemented. Each initiative will have a responsible person assigned to it, a budget allocated, and a timeline for execution. This way, objectives break down the broad goals into actionable and measurable steps, making them clear, time-bound, and practical. Each department is tasked with its own action plan. This action plan outlines the initiatives or steps required from the department to achieve the strategic goals we have set. Clear? All right, so let's discuss the difference between the strategic planning and master planning. Strategic planning involves the process of setting long terms and determining how to achieve them, while master planning refers to the older approach to planning projects which was more rigid and product focused. Master planning. In the past, the master plan was a structured blueprint used at the start of any project. It focused on producing a product or offering a service first, then using marketing and persuasion to convince people to purchase it. The customer's need were not the starting point. For instance, companies would produce something and then create advertisements to promote it, aiming to persuade people to buy. Customer needs were not prioritized. The approach was simply to produce and then sell. While the strategic planning begins with understanding the customer needs. The process involves identifying exactly what the customer wants and then producing products or services tailored to meet those needs. Strategic planning is customer driven, and the first step is conducting a SWOT analysis to assess the internal strengths and weaknesses as well as external opportunities and threats. While the master planning, there is no SWOT or emphasis on adaptability. It typically started with a mission statement and a broad vision, followed by the creation of a fixed plan. Planning was not seen as integral to management. In strategic planning, however, planning is an essential part of management. Nowadays, strategic plans were typically designed for a duration of 3 to 5 years and should be updated regularly, often not exceeding 4 years without review. This is because the world is evolving rapidly, and staying up to date is crucial for success. Master planning was long term and static, often spanning decades or even generations without significant change, while the strategic planning is dynamic, adaptable, and focuses on shorter cycles to ensure alignment with the fast paced changes in the market and customer needs. The shift from master planning to strategic planning reflects the need for businesses to be more flexible, innovative, and responsive to changes in their environment. The key aspects of leadership in quality in a way that highlights the essential role of leaders in driving excellence. As a senior support quality, initiatives must be supported by senior leadership. As a leader, I believe that the foundation of any quality initiative lies in senior leadership support. When senior leaders visibly champion quality initiatives, it sends a strong message to the entire organization about their importance, like allocating resources for quality programs, actively participating in quality reviews and decision making, and setting the tone for a culture of excellence. Without this commitment, it is challenging to sustain meaningful progress. Second, communication leaders must effectively communicate quality goals throughout the organization. An effective communication is at the heart of quality leadership. I ensure that quality goals are clearly defined and communicated across all levels of the organization, translated into actionable steps for teams to understand their roles in achieving them, regularly reinforced through meetings, updates, and recognition of progress. By doing this, I help align everyone with the organization's vision for quality, creating a unified effort toward improvement. And the last aspect is continuous improvement commitment to fostering ongoing quality enhancement. Leadership in quality also requires a relentless commitment to continuous improvement. It fosters a culture that encourages feedback and innovation. By embodying these principles, senior support, communication, and continuous improvement, leaders create an environment where quality thrives and becomes an integral part of the organization's success. Who is the governing body? The governing body refers to the owner of the organization or the general manager. In the case of a government entity, the governing body is typically a council rather than an individual. The governing body can take the form of a single individual or a high level administrative board and is ultimately responsible for all final decisions. The term ultimate responsibility is always tied to the governing body. Any legal, financial, or regulatory accountability falls under their jurisdiction. These are the people who make up the governing body, and their responsibilities are crucial to the organization's success. The governing body is accountable. Picture a scenario: a patient walks into the hospital expecting the best care possible. Behind the scenes, the governing body holds the ultimate responsibility for ensuring that the care provided is not just adequate but safe and of the highest quality. Whether it is a decision about hiring experienced doctors, ensuring proper hygiene protocols, or upgrading equipment, the governing body must ask, are we meeting our duty to ensure safety and quality? This responsibility is not just about policies, it is about lives. For instance, if a patient experiences a preventable error, the governing body must own the outcome. They are the ones who ensure systems are in place to prevent such events from happening again. The governing body is also responsible for resource allocation. Now let's shift gears. Imagine the hospital is considering a new initiative to reduce infection rates by implementing advanced sterilization equipment. The governing body's role here is to allocate the necessary resources. I will think of it like being the parent of a large family. I have to make sure everyone has enough foods, clothes, and school supplies. In the healthcare world, it's about ensuring there's sufficient support for quality initiatives so that patients get the best care possible. Another responsibility is strategic approval by approved quality plans and budgets. In a scenario, the quality department has developed a detailed plan to improve patient satisfaction scores. I will redesign the emergency department for faster triage. The governing body's job is to review and approve this plan. It is not just about saying yes or no, it is about I strategize. They approve initiatives that align with the organization's vision while ensuring that resources are used wisely. They oversight, monitor, and validate annual quality management evaluations. Let's move forward in time. I imagine it's the end of the year and the quality management team presents our annual evaluation. The governing body reviews it, validating the results. Did the infection rates go down? Did patient satisfaction improve? Are there areas where we fell short? And how can we address them? Oversight is like being the coach of a sports team. I just I don't just set the game plan. I watch the plays, review the results, and adjust strategies for the next game. These responsibilities, accountability, resource allocation, strategic approval, and oversight, the governing body is the glue that holds the healthcare organization together. They are not just decision makers, they are stewards of quality and safety, ensuring that every patient who walks through the doors gets the best care possible. The governing body plays a vital role in driving continuous improvement. They ensure that Mechanisms for evaluation, monitoring, and updating organizational strategies and practices are in place. When I talk about the governing body of an organization, I can go by several names depending on its structure, purpose, and region. Here are the common titles you might encounter. They are Board of Directors, Board of Trustees, Board of Governors, and Governing Board. These titles may vary depending on the organization structure, but they all refer to the entity responsible for the ultimate management and accountability of the organization. As professional in quality management, my role extends beyond just implementing systems. For instance, I am a quality manager in an organization. My responsibilities might include the following: communicating, communicate in a way that inspires action, involving others, motivating for success, helping the employees feel valued and pushes them to reach for higher levels of accomplishment. Rewarding. The key is finding the right reward, something that makes people feel appreciated and motivates them to continue supporting future changes. And lastly, promoting teamwork. I will encourage this by organizing regular huddles, fostering open communication, and creating a culture where every team member feels their voice matters. As a quality leader, our roles are communicating, involving, motivating, rewarding, and promoting teamwork. Create a ripple effect, a situation in which one event produces effects which spread and produce further effects. Each action builds trust, encourages collaboration, and ensures the success of the change initiative. By focusing on these areas, we can contribute to creating a culture of quality within the organization, ensuring that all staff members are aligned with the organization's strategic goals and committed to continuous improvement. And with that, we conclude today's lecture. I hope you all understood and learned all the concepts about the
Uh,
organizational leadership, leadership style, strategic planning, and quality management in the healthcare settings.
Thank you,
Do you
ma'am.
have any clarifications, additional information, perhaps?
Class.
Thank you for the time and patience.
Thank you. Thank you.
Thank you for your great offer, Annabella. So next lecture, inshallah, will be only discussing leadership cases.
Yes.
Inshallah,
Inshallah.
okay.
Inshallah,
Okay.
dai.
Thank
And
you so
next
much.
lecture will be this Monday, right?
Yes, on Monday, inshallah, Doc.
If is it okay for you and for the participants, you can manage lecture in Saturday and Monday instead of Thursday, because Thursday is weekend and maybe lots of them can't attend at weekend.
Okay,
Okay.
I agree with that. I don't have problem with that, Doc.
Okay, you can make voting at group, WhatsApp group, and take their opinion.
Okay, I will do so,
Thank you.
inshallah.